Welcome to the First Nations Health Managers Association's weekly town hall with your host, Marion Crow, your resource for COVID-19 related news and information. Send us your questions to FNHMA@ihtoday.ca. Over the next hour, you'll hear from health professionals and Indigenous community leaders. As always, we have reliable and credible information for you and your community. We want to hear from you.
Tansei from the already I'm blundering. It's going to go in the blooper reel, I tell you. I do want to start off by acknowledging the wonderful territory in which we are broadcasting from, and that is right now from the city of Toronto, the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat people. We are in the NationTalk studio, and my name is Marion Crow. I'm the Chief Executive Officer of the First Nations Health Managers Association. I am from Pipot First Nation in Saskatchewan. Papa Princess coming to you again. I'm currently working and living in the unceded, unsurrendered Algonquin territory. And thank you to everybody tuning in on the radio, who are going to watch this on APTN. This is the final for FNHMA Town Hall series on COVID-19. We will keep bringing it to you for another 4 hours, and then I think the work is over to you. It's been an amazing ride, but just a marker that you want to be tuning in for the next 3 weeks to see what we have in store. On June 30th, we're going to do a reflection back, acknowledge and celebrate all of the wonderful frontline workers who are keeping our nation safe. Thank you for welcoming us into your territories, nations, and organizations, and for getting your trusted, reliable, and credible information from the First Nations Health Managers Association. It is such a pleasure today to welcome back Leila Gillis from Indigenous Services Canada, a lot of folks who know Allison Fisher, Wabano Health Center, and we also have with us Chief Derrickson from I'm really on a blooper reel this start off. I'm so sorry. West Bank Chief, it is wonderful to have you as well. We will try to insert a little bit of laughter into the conversations too. And I think you guys know the drill by now, but for those who don't, if you have a question for any of the panelists today or in general, we'll make sure to respond to that if you shoot us an email to fnhma@ihtoday.ca. So again, a question, please send those in. We'll get them on the air today or follow up with a response on an upcoming town hall. But again, fnhma@ihtoday.ca. Let's get this party started. Come on into the crow's nest. Leila Gillis, welcome back.
Well, thank you so much, Marion. As always, it is such a real pleasure to be with you and the whole Town Hall team, and to have this opportunity to join you all on behalf of Indigenous Services Canada to share some COVID-related statistics for First Nations on reserve for the Town Hall today. Before I move into the update, I just want to acknowledge that today I am on the beautiful, traditional, and unceded territory of the Algonquin Anishinaabe Nation. And I want to acknowledge the traditional stewards of the lands upon which all of those participating in the town hall today gather, from coast to coast to coast. And as always, a special shout out to the east coast of Canada and Newfoundland, where I still call home and where my family still reside. To situate myself, I'll share that I am Indigenous Services Canada's Acting Chief Nursing Officer and Director General of the Office of Primary Health Care. And my office is situated within the National Office of Indigenous Services Canada. And I've been a registered nurse for over 30 years. I'll start today with sharing with you some of the current COVID-19 statistics as updated this week on June 6th. In this time period, the number of active COVID-19 cases reported in First Nations on reserve in Canada was 803. And this includes 193 new cases. That is compared to more than 24,000 active cases in Canada in total, with more than 1,500 of them new cases. Since the beginning of the pandemic, the total number of reported COVID cases in First Nation communities has been over 30,300, of which nearly 29,200 are reported as having recovered. This compares to nearly 1.4 million total cases in Canada, of which just over 1.35 million have thankfully recovered. Relative to COVID variants of concern on reserve, there have now been over 2,200 reported cases in total identified in First Nation communities. We have also been tracking hospitalizations over the past year, and there have been a total of 1,371 hospitalizations, of which thankfully there have been no new reported hospitalizations for this period for First Nations individuals who live on reserve. And just for comparison, that is compared to over 72,300 hospitalizations overall in Canada. So to summarize, although First Nations on reserve do have a higher reported infection rate than the rest of Canada, there is a lower percentage of hospitalizations for First Nations than that of the overall Canadian population, which can be a proxy or reflection of a lower level of severity of illness. And thankfully, there have been no deaths associated with COVID-19 for First Nations on reserve this week, and a total of 346 deaths having been associated with COVID-19 for First Nations on reserve across the country since the beginning of the pandemic. And the overall Canadian total number of deaths are now nearly 25,800. On the vaccine front, 596 First Nation communities located in the provinces have immunization access underway. And 385,252,000, I have to give the exact number for that one, of First Nation individuals living on reserve have received both their first and second dose of COVID vaccine. That's over 72% of eligible First Nations on reserve having had their first dose. And the last time I joined you on the town hall, last month, Canada had just cleared the Pfizer vaccine for 12 years and above. And since then, there's been great mobilization in communities to support youth to access their first dose of vaccine. With such promising overall vaccine uptake, there is a notable decrease in the active cases relative to the increase of vaccine coverage. So increased vaccine, lower COVID infection. And having been with you, Marion, and team for the last year, sharing COVID data through some really, really difficult times, these are encouraging trends. But communities and individuals on reserve and off should remain vigilant and continue to follow public health measures, including continuing to test for COVID-19. And while we all work to support extensive vaccine rollout, communities continue to track and support case finding and contact tracing for any new infections. And there are point-of-care testing devices available widely for testing and follow-up across the country. I know how exhausted our frontline healthcare providers are, and they have been working full out for such a long time in the fight against this COVID pandemic. This work is all on top of other healthcare supports and services, mental health and addictions, and all the additional pain that has been experienced over this past week and a half, I guess, and has almost been too much for community and other frontline staff. It's never been more important to care for yourselves and to reach out and support and care for those around you and check in on your friends and your family. It's never been more important to sort of be there for each other. And recognizing that ceremony has been so important and needed by so many in these past weeks. And while planning and sharing, please consider public health measures when holding ceremonies and recognition events to protect everyone. I'll now turn back to you, Marian, and thank you so much, of course, for the opportunity to share with you today. And I think this is my last time with you, so thank you so much for making this town hall, this important public service, so widely available. Thank you.
Leila, thank you so much for continuing to partner with the First Nations Health Managers Association, for responding the way that our partners at Indigenous Services Canada have done. Your time, your efforts, and your commitment are so very needed, and we're grateful. Thank you. Hi, Leila. Well, again, for any of those wanting to send in a question, you can send that to fnhma@ihtoday.ca. Before we transition to our next guest, I do want to do a couple of little special announcements to some watchers, actually. I'm sure she's watching right now. Happy birthday, Margaret Timms, one of the FNHMA family members. I hope your day is as beautiful as your spirit. And Kelsey Thompson, who is on maternity leave from the FNHMA family, had a birthday on Monday, and we wish her all the love with that newborn at home. Now, let's go over to a governance guru. I'm going to welcome in Chief Derrickson. Chief Derrickson is currently the Chief of West Bank First Nation. Come on into the crow's nest, Chief. Welcome.
Thank you, Marian. I think that's the first time I've been introduced as a government guru.
Governance.
Governance guru, and apparently today I'm supposed to be a COVID guru. First, I got to start off by saying I'm definitely not the expert on COVID-related or pandemic-related responses, but have learned a lot through the last year being surrounded by experts and people who actually know how to do this. It's also been an incredibly trying time for our community. As you know, there's been 215 children discovered at the Kamloops Indian Residential School, and our community's been impacted by that. And then that layered on top of COVID has really restricted our ability as a community and nation to mourn and to remember these 215 children. That being said, we have been finding ways to express safely our feelings and to gather together safely again, following all COVID protocols, to remember these children and to bring healing to our community. But that being said, so what have we done in our community? Of course, for all First Nation communities and Canada as a whole and the entire world, it's been an incredibly trying time the past year. Hard to believe it's been already been a year. And it's been a time travel for me, going back into the past. Hard to think that it's hard to believe that it's already been over a year since this pandemic started. And when this virus came into Canada, we were anticipating it being very serious in nature. We were already having discussions in our government that this virus was going to make it here to BC and that it was potentially going to be very serious. So we leaned forward, even before BC's public health officer, Dr. Bonnie Henry, who we all have grown to love here in BC and I think across Canada. Before she even imposed measures, we leaned forward and shut down government operations, in-person government operations. We stopped allowing people into our building. We closed down our daycare. This was in March of 2020, over a year ago. And then we continued from there to lean forward and implemented a three-part strategy that includes following all public health measures and in fact going above and beyond what was being required of us and imposing our own restrictions on our members and specifically our staff to the level that we could to make sure that we're protecting the health and well-being of our membership and our staff. Obviously, top of mind for our council, for our leadership in our community were our elders, those knowledge keepers, those people who speak the language. We only have a few of those left, so it was very important to us that we did everything we could to protect the last remaining language speakers and knowledge holders we have left, because once that knowledge leaves, and if there was a death due to COVID, then that knowledge is gone forever. Obviously, politically, like all governments across Canada, some of the decisions we made were not popular with our membership, but our council held the line and maintained a strong position in response to COVID-19. So moving from there, we continued to provide services to our members throughout the pandemic, despite being closed. We issued a COVID dividend to our membership. That was thanks to our corporate arm, Natiti Development Corporation, came up and offered a $400, I think it was a $400 dividend to membership to help relieve, that's for the blooper reel, relieve the stress of that members were feeling. People weren't sure about whether or not they would keep their jobs, whether they weren't sure about their future. I mean, it was all very unsettling when the pandemic first started. And so as a response to that, we issued the dividend. We also let our staff know that there would be no layoffs at Westbank First Nation. And to date, we have no pandemic-related layoffs. We were able to keep everybody on staff. Everybody continued to receive paychecks. Of course, that went to supporting families, supporting children, and ensuring that people didn't have another thing to worry about in the event that they were laid off. We continued through the summer to cancel events, obviously. Very difficult decisions were made to cancel our annual AGM with our membership in September. And we were very lucky that up until November, December, we had no outbreaks within our community. So our members, of course, followed the public health measures. It was funny to see that actually was our elders telling our young people that they needed to follow the public health measures and, of course, start packing these around and wearing masks. Then that led us into December, where we had our first outbreak within our community. And that was a very trying time, happened right before the Christmas break. And this is where I lift my hands to our staff and our Director of Community Services, Maria Reed, our Chief Administrative Officer, Simon Melanson, who stepped up along with our wellness team, our health team, and it's really the entire organization to address the outbreak that we were facing within community. And it went quick. It was the result of a social gathering. And we, at the height of it, had 35 people under isolation, or 35 different homes, affecting approximately, I think it was about 70 members within our community. And during that time, we continued through the Christmas break. Our staff worked to provide food, to provide necessities to these households in isolation, and continued, of course, to lean in to ensure that we do everything we can to make sure that virus didn't spread further within our community. Then into the new year, we had a second outbreak in our community, and of course, we followed the same protocols, got people isolated. We were able, thanks to the support of the First Nations Health Authority, to obtain a testing device. So we're using that daily. To date, we've administered just over 500, close to 600 tests, rapid tests within our community. And this has helped immensely in our response to help track the virus. In fact, the health authority here, the Interior Health Authority, told us we were doing a better job of tracking the virus and corralling the virus than they were able to do. And then that leads us to today, Marion. We're coming near the end of the pandemic. To date, we've administered over 1,000 doses of the vaccine. By the end of this week, all of members and our staff who are willing, including our local RCMP detachment, who are willing to be vaccinated, will have received their second dose. I received my second dose a few days ago and still thankfully feeling the effects of that dose because my immune system's working. And I'd like to also encourage your viewers and those listening to make sure you get vaccinated. And if you're questioning the science, or you're even apprehensive about getting vaccinated, I think it's important to remember the amount of work that's gone into these vaccines. They're incredibly advanced in a lot of research has gone in, and they weren't just created overnight. There's a lot of research that's gone in over the years to the creation and development of vaccines as the health industry, or as doctors and those who are experts in this field have been putting in the research over the years. So to date, Marion, glad to say no further outbreaks within our community. We continue to look forward to the reopening of our government offices to members. We're starting to bring our staff back, who were sent home obviously back in March to work from home, and we're slowly opening up to new community events. And we're hoping to host this summer a community cultural camp over the course of 4 days to bring people together safely, again, if there's health measures in place. And I'm really hopeful that we'll be able to gather in September for our annual general meeting with our membership.
Thank you so much, Chief Derrickson, for sharing the COVID journey, and especially for making time, given this heartbreaking time coming out of Kamloops. I really appreciate your governance, your leadership, and ensuring that you're choosing to exercise your sovereignty when needed, and closing those borders and putting all of the guidelines in place that needed to be. It's not always an easy job, and we admire all of the people who have the courage to make those decisions, so that when we gather again, we're not missing anybody from those celebrations, powwows, and all the special moments that we want them to be around forever for. Thank you again. With that, I do want to send another reminder that the question inbox and the email for that is fnhma@ihtoday.ca. With that, it gives me a great pleasure to introduce and call into the crow's nest the Executive Director of Wabano Health Services, Allison Fisher. Come on into the crow's nest. And I said earlier, not all superheroes wear a cape or a yellow shirt, but today, that's you. Come on in, superhero.
Once in a while, it's lovely to be called that, eh? Right? You want to be the Wonder Woman with the red cape. Thank you for being here. I've always wanted to be in the crow's nest, so here I am. So thank you for having me today. It is a true pleasure. I always like to say where I come from. I've been at Wabano for 22 years, but I do come from Kumakong First Nations on Manitoulin Island, and that is in Middle Ontario. And it is a community that has taught me everything. So, you know, all the work that we do and all the translation we give as people, we transfer that to each other. And I want to thank my community for giving me that wonderful start. Thank you much. So I want to talk about COVID and vaccinations today. But, you know, we're always wanting to rise to tell better stories. And we have many great stories in this country that are, so many of our communities have risen and up to the challenge and produced incredible stories in each of their communities. But our story began last March also, and Wabano was deemed an essential service, so we did not close. We were open all the time for in-person supports. So during those really dark months, you know, there was this incredible sense of chaos. Supply chains were uneven, access to service was negligible, and that was layered with enormous fear and anxiety. And that was the environment that we had to work in. So during that period of time, there was tremendous amount of advocacy for at multiple levels of government, municipal, provincial, and federal, in order to meet the needs and respond to our community. But in Wabano, our immediate pivot was to change our service delivery and deal with intense advocacy and to prioritize our seniors immediately. We had to keep our old people safe. So a huge portion of our staff within the organization shifted their work and focused very intensely on maintaining safety in the community. And the other challenges, of course, were securing supplies, PPEs. That was a very difficult period of time and continued to be so for many months. But we shifted, and we were able to, get the necessary things that we needed to do that good job. But one of the things I think that I'm particularly proud of is that we responded immediately by outreaching to our community to find out what their needs were. We did a survey. We did 700 people responded back. We were dealing with issues which they highlighted were food insecurity, digital inequity, isolation, and parenting, and what were they going to do about their children in schools. So from that, we got a lot of data that allowed us then to navigate and to change the way we did and provided service to the community because of that information. So we continue to do a lot more outreach. I'm very proud of our staff. We did during that period of time 26,600 and such wellness checks. So our community felt supported. They were called constantly to ensure just every single day someone out there was getting a call from Wabano saying, how are you doing? What do you need? And what is it that we can do to make your life better? And the outpouring of gratitude was tremendous from our community, with letters and phone calls, and just once we've opened up a little bit more, just that thank you, that miigwech, to say, as a community we did a great job. So a little on the vaccination front. Last fall, there was intense discussions at the provincial level about how the rollout was going to be in Ontario for vaccinations. And there was points where the urban voice was not very strong. So there was lots of intense, support and work around that area that ultimately on February the 18th, we had the first vaccination given to an 85-year-old woman who was vaccinated here in Wabano in our grand cultural space. And we focused our first level of vaccinations on 70 plus, and we did 785 vaccines at that time. And the relief and the notion of gratitude from their faces was the greatest gift that our staff could receive, because they had done such hard work through the year, and to see the faces. But it was like old home week for them. It was their first time out, and it was just like a party. They were so excited to tell us something that had happened, or what their dreams were for the coming months after they would receive their second dose. So that so during that period of time, there were just so many wonderful things that happened, and I don't have the time to talk about them today. But we had our first vaccination site here, and then we moved because we have a large population in Ottawa, so we had to move to a larger complex, the St. Laurent complex, where we began to do vaccinations there in partnership with the Ottawa Public Health. And we also did some pop-ups. We did with Tungasivig Inuit. We did a pop-up out in the West End to ensure that people who had transportation issues would at least have some kind of access. So those were all very successful. And to date, we have vaccinated with Akosivik, which is the family health team, and Wabano, a total of 23,500 vaccinations to date. So we have I think we have done an enormous job, but we have to continue because we have a large population in Ottawa. So we're vaccinating every day, and we now are focusing on the young folk who are actually incredibly excited to receive the vaccination. We all thought there would be some hesitancy there, but there hasn't been any whatsoever. I think one of our challenges, though, was the communications issues in the city. We assume that everybody is on, has access to all the things that we have access to, but there was a constant awareness of the digital inequity out there. So a lot of our work had to be actually driving and going from door to door, knocking on doors or sending letters or sending postcards or all of the ways that we could to try and increase the rate of knowledge out there that vaccinations were there. And we continue to see that there is still a gap around people reaching the information or struggling with other barriers in order to be vaccinated, because our city is large. And we have only one site at the moment that is located in the East End. But that is, I think, a success that I am very proud of. And also, it also is an indication of how an Indigenous organization can partner with a public health institution and really come together and develop a strategy and a place of belonging in a very difficult situation, and make it all positive for our people. One of our elders came into this large area for her second dose, and she said to me that I never thought I could come into an arena and have all this artwork all around me, because one of our artists in Wabano every day would go to the arena and would actually draw a piece of artwork during that day. So it was an incredible experience for her. She said, I really felt that everything was going to be okay. So that's sort of my update on our big success in Ottawa. So thank you.
Congratulations, Allison. And we're going to have some questions for all of our panelists, so don't sneak away from the crow's nest. Don't go too far yet. Allison, I just can't imagine what it was like pounding those tables to ensure the equity of getting vaccines into arms, especially when you talk about some of the challenges with respect to connectivity. Not all of us have the privilege of carrying iPhones and having an internet access. So to be able to hear that there are organizations going out and knocking on doors to get people services, wow, heartfelt. I'm at a loss for words. Doesn't happen often. All right, Allison, I'll just get you to mute for a moment. And I do want to say a couple of hellos to people who are tuned in. Jarrett, thank you so much for watching the FNHMA Town Hall. Dawson, we see you too. And Tammy, hi. This isn't Romper Room, but thanks for watching. There will be an age of people who will not get that little joke about Romper Room, but we'll carry on. So I do have a couple of questions for our panelists, and it's not too late for others. Again, FNHMA@ihtoday.ca. Leila, I'll get you to unmute and come back into the crow's nest. There is a question here that I'd like to ask you. So the question is, Leila, our community hasn't had any cases Our borders are open. I feel some of our community members are not being as vigilant as the first wave. Are there examples of this happening in other communities that now have large outbreaks? What are you hearing through our Moccasin Telegraph, Leila, about folks who aren't being so vigilant as they were in that first wave?
Thanks, Marion. And every time you mention romper room, I get a pain because my name was never mentioned.
Mine either.
Not many Leilas out there. But thanks for the question. For sure, this is, as I mentioned earlier, it's not the time to be sort of lowering our guard. There's a statement that says that none of us are safe until we're all safe. And I think that's a really good example. While we're still rolling out vaccine, not everybody is vaccinated. The risk of infection is still out there. So, I think that people are tired. It's also a really trying time. And I think that, individuals just want to be together. But, as the chief mentioned, there's ways to do that while respecting, COVID, public health protocols. And so there are still some outbreaks happening, even with our high vaccination rate. And so, there's still some risk of transmission because not everybody is vaccinated. So, there, that's happening across the country, and public health officials right across the country are really, imploring with people to please to be safe and to respect public health protocols. Because the more we mix, the more that they're spread, the more risk there are of variants of concern, and of course we want to prevent that. So so there are some cases, but there's so many other examples of such excellent governance and respect for public health measures across the country, all at the same time. So I think there are some, but I think they're under control. And communities are taking it seriously for the most part.
Thank you, Leila. I almost forgot to unmute myself. It's going to be the t-shirt of 2020, 2021. You're on mute. Okay. Not a comedian, as you can see, but a little lightening up of the mood there. Let's go. You know what? No need to come into the crow's nest. I do want to read a comment for Allison. Allison, there is a comment just for you, and it is, congratulations. We want to recognize and acknowledge the extraordinary coordination of the Wabano Center staff in Ottawa in their COVID-19 immunization clinics. The feeling of safe space reduced the anxiety of our people coming in for treatments and vaccines. Congratulations to Allison. So we have to hold each other up, recognize the people who are working tirelessly in doing their part in keeping our nation safe. So, Chief Derrickson, there are a couple of questions for you. So welcome back into the crow's nest. And I'll just remind you to unmute yourself. Chief Derrickson, the comment here, the question actually is, what do you think you and your colleagues, other chiefs, have learned through this pandemic? Will you be adding to your health infrastructure? What do you think is going to be kind of the first keepers of our new norm in your eyes, Chief?
That's an excellent question. I've learned an immense amount over the past year, and I think as a society, as a global community, we've learned a lot. And I think it's time to start, first of all, to listening to the experts. We knew a pandemic was imminent. We knew that eventually we would be in this situation, but governments around the world failed to listen to that advice, and that's part of the reason we found ourselves responding so abruptly to the pandemic back in 2020. Personally, I've learned that it's important to have the services in place that are able to pivot, as was mentioned by our other guest, Allison, that you need to be able to find ways to continue to serve your membership despite having these barriers in place, whether that's going to be a pandemic or some other emergency related response. Being able to have a staff that can pivot quickly. Are we still good here? Screen just, okay. To pivot quickly to continue to provide those services is important. So are we going to be continuing to invest in our health infrastructure? Obviously, of course. We also own and operate a Pine Acres Home, a long-term care facility. Luckily, we had 0 outbreaks in that facility. Our staff stepped up, worked under trying conditions, and a shout out to all of our health practitioners out there and service providers who stepped up during this time. Remember, we were banging pots at 7 p.m. Every night for a while there in recognition of their efforts. But that industry is also going to change. I think you'll see changes across industries to ensure that if this or when this happens again, we'll be better prepared and have the infrastructure in place to respond quickly. And in doing so, we're going to save lives. Personally, on a personal level, what have I learned? I've learned that there is an immense amount of care and love within our communities. Our community came together. Our community found ways to reach out to one another, despite not being able to hug our parents for months on end or see our loved ones for months on end in person. Our community still found ways to pull together. And to me, that's been the greatest learning opportunity for me, is to see how the depth of our community's love for each other and care for one another.
Chief, you said that so well. The demonstration of love, of resilience, of caring for one another. And that just is our good values coming out again and again. I am so happy that we are strong, resilient, and we're getting through this together. Oh, powerful stuff here. You're hearing this on the FNHMA town halls on COVID-19. Just another friendly reminder, we have 3 more shows left. I'm really looking forward to having some co-hosts on June 30th, the last episode, and we won't be picking up this dialogue any further. I think you've had enough COVID-19 information from FNHMA, and with the stats going the way they are, we are just delighted to have been a part of this shared journey. With that, I think what I'll do is call back in. Leila, come on back in. You should see just before you come in, Leila, I accidentally bumped something on my computer and my camera disconnected. You should see the frenzy of masked faces that all of a sudden started running in the background here. So I apologize to the studio and the tech team. Me bad, sorry. Aren't I cute? Sorry about that. Okay, come back in, Leila. So, Leila, is it still, you talked already about the diligence that we need to maintain in upholding those public health guidelines. Here's like a very simple question. Are we still possible spreaders of COVID-19 virus, even if we've had both vaccines?
Great, thanks for the question, Marion. And kudos to you for continuing on with the frenzy around you. I think that we're still, as we increase the number of vaccine uptakes and this, surveil the vaccine rollout across the country, we're learning more and more. And, the evidence is, still being gathered, but early evidence is definitely showing that obviously there's a reduction in severity of illness, of hospitalizations for anyone who may have a breakthrough infection. but also that transmission of COVID-19 is reduced with vaccination. But I can't say it enough that until everybody is vaccinated, there's always a chance of carrying, and spreading the virus. So that's why public health measures, until we hit, and we've heard the whole herd immunity, but the right amount of coverage of vaccine within communities, can we really say that we're safe and that transmission is very unlikely. But right now, there is evidence that there is reduced transmission with vaccination. However, it's not completely not possible to transmit. So that's why until we have more fulsome vaccination across the country, it's super important to maintain public health measures to assure we protect everyone.
Thank you, Leila. Allison, come on back into the crow's nest, please. So, Allison, the question I have for you from one of our either listeners or viewers, and thank you to all of our Indigenous media partners for putting this on all the Indigenous radio stations as well. Allison, what were some more of the challenges you faced with the vaccine rollout? And do you have any other superheroes you want to thank as well?
I always want to thank my staff, really. When you work for as long as we have, every single day, and day in and day out without rest, I think that one must never forget that piece in the continuous supports. Other than communications challenges, obviously I think there was so much miscommunication at multiple levels. Things changed all the time. We never, and I think that's just because everyone is learning. So it just meant that sometimes we would get some kind of information on one day, and then that information would change, 3 days later, and then we'd have to pivot, which meant that we then would have to spend time on the weekends calling people back. Their appointments had changed. So that used a lot of human resource. But otherwise, other than the general First Start advocacy part, where we, the insistence of having vaccines in the urban centers, I think the learning process and the learning together, with all the little things that happen, sometimes big, sometimes small in the context, I think it was fine. We worked through it together, and our community was patient. Was the other. Our community was so patient. They understood that we were starting with the old and moving down, by age. And I think that I have to give kudos to our community at large for being patient. And when they didn't know, they would call and they would ask. So that was really important. So thank you.
Thank you, Allison. And I got to tell you, the inbox is on fire. There must be a lot of unceded, unsurrendered Algonquin territory folks who are watching right now. It's just unbelievable. The thanks, gratitude, raving about the experience. You got people in and out within 30 minutes. The impact on their mental health was extraordinary, lifted in terms of having that confidence of an Indigenous-led organization, making sure that we had needles in arms. So I just wanted to let you know, Allison, this is spectacular. You are the hero of this hour, I have to say. So thank you again, Allison. Chief Derrickson, I'm going to call you back on in if you don't mind. There is a question for you, Chief. The comment and the question is, you are in a unique position as West Bank First Nation, really an urban kind of environment that compounded challenges how have you been able to manage the flow of people? What does tourism look like for the future? And, what are some of your other thoughts that you want to share with our viewers and listeners at this time?
Thanks, Mary. Well, I should have mentioned off the top that we are, of course, an urban First Nation. We have over 10,000 non-member residents living on our lands. We're abutted by the city of Kelowna and the city of West Kelowna on either sides of our reserve. And of course, we're right in the middle of that, and have over 500 businesses located on our reserve lands. It was actually, I will admittedly so. I enjoyed the pandemic last summer because there were no tourists, and everyone in the tourism industry, forgive me for saying that, but we actually had very few boats on the lake. As locals, we were able to enjoy our beaches, enjoy those amenities that are normally taken up and used by the tourists, who we hope come back, and we invite to come back to our lands. But during that time, it was a very difficult time for wineries in the region. For one of our members who just right before the pandemic started, opened up a gift shop here on our lands. And thankfully, we've had very few business closures on our lands as a result of the pandemic. In fact, our economic development department reached out to businesses early on in the pandemic to see how they were doing and what supports we could offer. As a government, we did what we could in reducing their property taxes that the businesses paid. And of course, then regionally, the Mayor of Kelowna set up a regional economic task force for us to come together as leaders, with the mayors in the region, to address the needs of the business community coming out, not just coming out of the pandemic, but through the pandemic itself. So we are moving towards reopening the economy here. And I just want to thank all of our residents here and members who continue to support our local businesses. And in fact, despite a few closures, we're starting to see new businesses opening on West Bank First Nation lands, and that's encouraging to see.
Thank you so much, Chief. Leila, I'm calling you back in. Just because it's your last show, don't think I'm going to go easy on you, my friend. Leila, the question specifically for you is, many people infected with COVID-19 still have not been vaccinated. Can you explain why it is so critical to get tested and vaccinated, even if you've had a positive COVID diagnosis in the past?
Yeah, no, it's obviously it's important. Do you ever get a cold twice? I think that it's important for many reasons to have your COVID vaccine, even if you've been tested positive. I will say, if you've recently been tested positive, it's really important to complete your self-isolation period prior to accessing to assure that you have all the antibodies and all of the ability to fight that and to boost with your second dose so that you're protected as much as possible. And I just want to reiterate that it is important to assure that you haven't tested positive recently, but that if you safely complete it is you're to get your and then to follow the recommendations of your public health team on your vaccine schedule.
All right, Leila, excellent. Appreciate that. A good follow-up too, especially when we heard from Dr. Shannon McDonald last week, my dear friend at the First Nation Health Authority, of her positive COVID result after having had that first vaccine. So public health guidelines are there to protect all of us. And I definitely, am proud to wear a beautiful mask. I don't know if you guys can see this, but it's a great time to celebrate Indigenous business as well. And I see Allison is showing her pin there too. Love it. Allison, come back in for a second. In about a minute, Allison, can you tell me, were volunteers a part of this campaign in getting outreach to Ottawa?
Well, because of the fact that we didn't want any spread and we wanted to keep people safe, no, we did not use volunteers. This was all staff. So it was
And
contained.
what a remarkable staff you have. What do you have there, Allison?
Be great, vaccinate is it was our sort of our hashtag. That's right. Be safe, vaccinate. Right?
Allison, I can't even tell you how many times I have referenced that here on this show. Hashtag be great, vaccinate. I think that's a good way to wrap up this hour because it goes by just like that. I want to thank, obviously, the wonderful panelists we had on today. Miigwech, Allison, Leila, thank you. Chief Derrickson, all the way out in the West, thank you so much for being part of sharing information. And with that, we do have some more thank yous to acknowledge as well. Imagine this doesn't get done by one person. There is a whole team, including Indigenous Health Today, produced by NationTalk. We love the family of NationTalk working with us. We also want to say thank you to Indigenous partners like Mi'kmaq, Maliseet, Native News, The Wolf 95.7 in Fredericton, Nation News in Montreal, Element FM in Toronto and Ottawa, Anishinaabe Nation in North Bay, Wawate News in the Sioux, of course, CF. Wow, this is the blooper episode. I apologize today. Thank you to APTN, our newest partner. And hey, you can watch this on APTN. Check your local listings, but Eastern Standard Time is 5 p.m. We also say thanks to MBC Radio, Eagle Feather News, Alberta Native News, CJWE, CFWE, CKLB in Yellowknife, Co-op Radio in Vancouver, First Nations Drum, and Hashlasa Newspaper. Now, I'm sure I bloopered that one as well. Oh, what a day. I'll tell you too, it's 40 degrees in this office with no air right now. So I'm going to take myself away, wish you a safe, healthy, be great, vaccinate. That is the parting word. So until next week, stay safe and high